So psychedelics are extremely exciting. And you know what? They're actually a good example of how you make a medical product out of compounds that have been regarded as extremely controversial.
It's natural for us to continue to push for proper clarity on natural solutions and try and integrate them into mainstream medical practices.
We really need to move away from the stigma around it. And I think stigma is something that is a huge challenge because we can't solve a problem unless we have open and honest conversations about it.
Psychedelics are interesting to me. I have a history of cancer in my family. I'm a 2-time cancer survivor and I suffer from pain still today. And so we are happy that CannaTech is going to help us explore that path.
You have groups of scientists that have put forth very well-designed clinical studies, and all of a sudden you have an extract out of what was once called a magic mushroom and now is kind of rebranded as, the medicine psilocybin, but you have good methodology.
It is a freedom of consciousness. The conversation of euphorics will change adult use drastically. We're talking about activating synapses in your brain or your endocannabinoid system that aren't triggered by any legal products in the market. And the insights that you're able to have and the capabilities for a non-egoic moment is incredibly powerful.
We use about 5% of our brain. And if we are able to make use of natural substances in order to get us to access these hidden chambers in our minds, I am all for that.
Psychedelic-assisted psychotherapy is an area that, we're going to learn more about and hear more about in the future.
I'm very excited to see where psychedelics goes. I do think there is huge volumes of potential. We see it as certainly a next wave of natural medicine.